The patient had ongoing symptoms of ischemia, so we administered nitroglycerin sprays every 3 to 5 minutes for a total of 2 doses. 3 is the max. We monitored the patient's blood pressure in between each dose.
Before giving nitrates in any form, make sure there are no contraindications, such as severe bradycardia, tachycardia, or hypotension. Also, confirm that the patient hasn't taken any phosphodiesterase inhibitors for erectile dysfunction in the past 24 to 48 hours. Patients with inferior wall STEMI on their 12-lead ECG can often have right ventricular involvement. This can be confirmed by a right-sided 12-lead. If RV infarction is present or suspected, nitrates in all forms are contraindicated. Clinically, it may be suspected in patients with hypotension, clear lungs, and elevated JVD. If the patient receives nitroglycerin but does not experience pain relief, healthcare providers can consider giving analgesics, such as morphine, while monitoring the patient's blood pressure and respiratory rate. Use morphine with caution for patients with unstable angina.
County Medical, this is Rescue 1. We've got a STEMI alert. 46-year-old male, chest discomfort started half an hour ago. Current vital signs are BP 104/78 with a heart rate of 96. Pulse ox 95%. He's chewed 325 milligrams of aspirin and received 2 rounds of nitroglycerin sprays, but still says he has chest discomfort. 12 lead shows ST segment elevation of 3 to 4 millimeters in leads V1 through V4. ETA to your facility is 10 minutes.
At Rescue 1, we received your 12 lead and your initial report. We'll activate our heart alert system, contact the cardiologist and the cardiac cath team. Getting this advance notice really helps us speed treatment of these patients, increasing their chance of survival. We can have the cath lab prepped and ready by the time the patient hits the doors of the ED.
The American Heart Association recommends that EMS personnel transport patients who have a STEMI to the closest appropriate facility that provides reperfusion without delay. Based on hospital local protocol and cath lab team being prepped and in place, it is best practice to bypass the ED and take the patient straight to the cath lab, where initial evaluation can take place.
Studies show that ED evaluations are responsible for as much as 33% of the total time from symptom onset to treatment. We try to reduce delays by having everything ready when the medics arrive. After seeing the 12 lead that the medics had sent, I immediately activated a PCI team and alerted the cardiologist.
When the patient arrives at the ED, we move to the next step in the ACS algorithm.
Reperfusion goals for STEMI patients include PCI within 90 minutes after the first medical contact, or fibrinolytics within 30 minutes from ED arrival. The appropriate therapy is defined by patient and center criteria.
Within the first 10 minutes after arrival, staff should provide an immediate assessment of the patient. That includes taking vital signs, getting a brief, targeted medical history, completing a fibrinolytic checklist, and obtaining blood studies. If the early ECG shows no signs of ST segment elevation, then a repeat ECG in the ED is warranted. The staff should also get a chest X-ray within the first 30 minutes after arrival. In addition, draw a STEMI panel. Adjunctive treatments include unfractionated or low molecular weight heparin, bivalirudin, P2Y12 inhibitors, IV nitroglycerin, beta blockers, and glycoprotein 2B3A inhibitors.
Hi, I'm Dr. Taylor.
Hi, how is he? Did he have a heart attack?
I'm afraid so, but his vitals are improving. Dr. Abrams is an excellent cardiologist, and he'll be going over the next steps with you.
Okay,
You'll be in good hands with him, okay?
thank you.
This patient presented with ST segment elevation of 3 to 4 millimeters in leads V1 through V4. Now, this suggests that his LAD artery is occluded. Immediately opening up the artery with PCI and restoring normal blood flow is my primary goal.
The final link in the STEMI chain of survival is treatment. The preferred reperfusion strategy for STEMI patients is PCI.
Hi, Mr. Brennan, I'm Dr. Abrams, your cardiologist. How are you feeling?
Not so good.
Well, hopefully you'll be feeling a lot better soon. I just want to talk to you a little bit about what's going on.
I've reviewed your ECG, and it appears you have a blockage in one of the arteries to your heart. Now, to open the artery, we need to perform a procedure called PCI that'll help reestablish blood flow to your heart. Basically, we insert a catheter into the artery with the blockage and inflate a balloon to widen the blocked area. We then place a stent to keep the artery open. And the sooner we can do this procedure, the less damage may be done to your heart. Okay?
Okay. I understand. I'm ready.
All right. Let's see what we can do to help you get better, okay? All right.